all other protocols duly observed. I am highly honored and privileged to give the welcome address on this special occasion of the visit of the Right Honorable Speaker of Parliament to the Nadowli District Hospital to deliver consumables. A very warm welcome to our Honorable Member of Parliament, our District Chief Executive and other invited guests. Special recognition is due to our Right Honorable Speaker of Parliament and his better half. It is a true honor to have you in our midst today, and we express our biggest gratitude for the visit and your kind gesture. Distinguished ladies and gentlemen, permit me to state emphatically that this is not the first time our guest of honor has visited this hospital. He has been here a couple of times and has visited other health facilities to interact with our staff and to take first-hand information on health issues. I remember one particular visit when he came. Whilst we were waiting for him, I asked my driver to check on him at the district assembly at DC's office. The driver, is Honorable coming? I had no response, so I was wondering what was happening. Apparently, at the time that he was the second Deputy Speaker of Parliament, had hopped into my pickup and was coming with the driver. So, ladies and gentlemen, friends of the media, permit me to give some few highlights of the health situation in the district in my welcome address, since this is always a rare opportunity. If you find him in your midst, pour out everything, or else it will be difficult getting him again. The Nadowli district has a total of 56 health facilities comprising of 2 hospitals, one public and the other the Ahmadiyya. And the public one is the Nadowli District Hospital, which serves as a referral facility for the district, all the other health facilities, as well as the Dapiama Busie Isa district. Most of the clients from Dapiama normally would come here. We have 11 health centers and 43 chip zones. Out of the 11 health centers, 4 are CHAP facilities and 7 public health facilities. Regarding CHIP implementation, 27 out of the 43 chip zones are compounds, while the others are operating from the health centers, which is quite capital intensive. 2 others are under construction, Papu and Natoduri, and we hope to get them completed this year with the able leadership of our District Chief Executive. Although the staffing situation has improved significantly, we have challenges with staff mix. You can have some cadres of staff being posted, for instance, the enrolled nurses, but we lack medical doctors, specialist nurses, and physician assistants. The limited number of physician assistants is seriously affecting the quality of clinical care at the health center level. Because they are not there, we find nurses who become prescribers and do things that they are not expected to do, but under the circumstances for which they work, they would usually have to provide such services. So this is actually affecting service delivery. Out of the 11 health centers, only 6 of them have physician assistants. And out of the 6, 3 are for the public facilities. The rest do not have physician assistants. And without a physician assistant, the Health Insurance Authority will not credential you as a health center. You will be credentialed as a chief with midwife, meaning that you cannot provide some services at that level. And I think that this is going to undermine our efforts to achieving universal health coverage. This might be a mirage if we do not do something about the physician assistant situation. There is also a challenge of the retention of staff. Once we get them, within a very short time, they want to leave. All staff who come into the region want to be in Nadowli Kaleo, and they'll mostly say they want to be in Lohoches. So the last time I had to ask whether Lohoches was a teaching hospital. And most of them, it's a high demand of what? spousal posting. They will take my husband. They will take my husband. But the question I ask is, can the men also come after the women so that they can retain their jobs? The men are here. Health financing remains a huge challenge to the district, as the district depends solely on internally generated funds for health centers, which is woefully inadequate. The hospital also has to depend on their internally generated funds to do everything within the hospital. Right, Honorable Speaker, the health sector has come to terms that the district health system strengthening over the years has focused on chip strategy, and the district hospital, to the neglect of these health centers, for which the chip zones and communities refer cases to, because the health centers will have to serve as the gatekeeper. And so you shouldn't have clients moving from the communities straight to a district hospital. In terms of access, that becomes a very big challenge, considering the distances. So if our health centers are strengthened, and then we put in the needed equipment and staff, it will what? Strengthen the gatekeeper system, and people will not have to walk distances. We equally have leadership challenges at the district level and a general flagging attitude. To address these challenges, the Ghana Health Service and the Ministry of Health has instituted what we call the Model Health Center concept and the networks of practice, where you have a group of facilities within the geographical area, networking and sharing resources, skills and everything. So if I have a midwife, you don't have a midwife, instead of moving the client, that skillful person would have to move to attend to the client. And that makes life easy for the client. So this is the paradigm shift for the Ghana Health Service, the networks of practice. We as a district are fortunate to be supported by USAID, Momentum Country and Global Leadership to pilot the networks of practice in 2 sub-districts, namely Sombo and Jack. They have supported us with equipment, training, and as I speak, there are specialists, pediatrician specialists from Bolga and other places who are currently doing training for them, and you have the opportunity to interact with them. So it has actually strengthened the skills of those 2 facilities. But how about the others? The Ghana Health Service has also asked us to select 2 additional facilities, and we have selected Tako and Cherpong for Ghana Health Service, and we'll be having support from the World Bank to also strengthen the networks of practice. This concept seeks to establish well-trained staff and equipped health centers at the sub-district to provide comprehensive and integrated primary healthcare services with effective referral linkages from the peripheral health facilities and the district hospital. As a district, we have strategically positioned the facilities for the networks of practice. We have looked at the Cherpong enclave, and we have been able to put up a lab there with your support. Sombo very central to cover that area. The Tako enclave, Jam that is off track. Jam can usually not refer cases to us. They refer the cases to WAC, which is closer, and in terms of access to transport. And then we also have the Kaleo enclave. So this is how we have strategically positioned our healthcare delivery, so that for every area, people can have access to a model health center. The reason why we had to come to your office to solicit for support to expand the Tako Health Center, because you have done that for Cherpong, and you heeded to our request, and works are ongoing, moving into a bigger facility. Regardless of this progress, we still have some nagging or teething issues. Transport is a challenge, health infrastructure, and funding issues. Considering the quality of our roads and inaccessibility during the rainy season, I can mention quite a number of them. Kuri Dire during the rainy season, you can't cross. Chersombo, you can't cross. Pampina, you can't go there. Kopieri, you can't go there. And countless. So we need very strong and robust motorbikes and vehicles. Similarly, our health infrastructure is inadequate and poor, especially if we want to attract specialists and doctors and other staff. At the community level, it is difficult to get decent accommodation to rent for the nurses. So even as we ask for staff, we are also always worried about where they will lay their heads. Right, Honorable Speaker, this is a humble appeal. I would be very grateful if you could support us establish a Right Honorable Speaker ASK Bagbin Award system for deserving staff. This, I think, will motivate them to stay. So we can tag that award system by your name. We can say it is Right Honorable ASK Bagbin Award system for deserving staff. And we also consider those who have agreed to go to the deprived and remote areas to serve the poor and vulnerable, which I know they are dear to your heart. I remember in the past year, medical doctors and other staff opted to come to this district to work purposely because of you. Some personally mentioned that, even though they didn't know you, but they simply wanted to come to the district to provide services because of you. Distinguished ladies and gentlemen, permit me now to enumerate some of the contributions of the Right Speaker of Parliament to the health sector before I take my seat. Action of Doctors Bangalore, where my medical superintendent is currently staying. Procurement of a digital X-ray machine. Nadowli was the first to have a digital X-ray machine in the whole region. An aesthetic machine and many others. He did not limit the support to just hospital, but extended benevolence in the peripheral health facilities by extending laboratory services to 3 health centers to increase access to diagnostic centers. We have Sombog, Jam, and Cherpong. And it is sad to note that the staff that was posted to Cherpong has declined because he couldn't get accommodation. Yet the equipment are all there. He also expanded maternity units in some health facilities, strengthened maternal and child health services. In his quest to increase both geographical and financial access to healthcare in the district, he constructed a number of CHIPS compounds across the length and breadth of the district, thus bringing healthcare to the doorsteps of the rural, deprived, and marginalized communities, making a significant difference in their health status. Facility is completed. His dedicated service, positive attitude, good human relations with health staff has constantly motivated and boosted the morale of our staff, our workforce, to go on the extra mile. He is a mentor to many, a father to all, and a financier to the needy. Thank you for your fatherly love and support. You are simply amazing. Let me now also use this opportunity as he's here to appreciate most of our development partners, USAID Q4H, USAID FCGL, USAID RE2, Resilience in Northern Ghana, Azuma Resources. It is with the support of Azuma Resources that we have this facility is yet to be completed. They have been supporting us. And the media and all other invited guests, stakeholders, who are here today to witness this very important occasion. Our Honorable District Chief Executive, your door is always open. We go there, we spend hours chatting with her. And each time we get there, they say, I hope you are not coming with a new thing. I said, today is another thing we are bringing. And we'll discuss that at length. We move to the communities. The Honorable MP is doing quite a lot, providing delivery beds, expanding the maternity or delivery rooms that have been initiated by communities and giving us the needed support. And I know together as a team, we have these 3 powerful people in our midst as a district. We should definitely be transforming this district. And in the next couple of years, we want to see a teaching hospital in the Nadowli district. So we are truly grateful. And you are once again welcome to this ceremony. Thank you, Yabar Kayara.
I think we need to appreciate Mr. Director once again. He has poured out a lot regarding the district. God, thank you so much. God bless you. Continue with your acknowledgement as the program goes on. We acknowledge the presence of the NDC Chairman Sakara. You are most welcome. Then the CEO of African City Gardens, Mr. Jebuni Mensah. But we don't actually know the ins and outs of the district hospital, how it began, what has happened so far. Today is an opportunity for most of us to know what the district hospital stands for, the brief background. So based on that, we call on the medical superintendent of the facility, Dr. Emmanuel Opoku Amponsa, to give us a brief background of the facility.
Thank you. Right, Honorable Speaker, and your able to lady of the land, Honorable District Chief Executive, Right, Honorable Speaker, and your able to lady of the land, Honorable District Chief Executive, Nadowli Hospital, Honorable Member of Parliament at the Kwesi Constituency, representative of the Regional Director of Health Services, District Director of Health Service, management and staff from Nadowli District Hospital, and District Health Administration, chiefs and elders of Nadowli Hospital, members of the District Health Committee, various party functionaries present, friends of the media, invited guests, police health workers. It was later elevated to the status of the district hospital in the year 2001, without benefiting from infrastructure, equipment, and logistical upgrading. The hospital since its establishment has been the main referral point for 13 sub-districts and over 45 health facilities and 138 communities in the Nadowli and Dafiama Guse district. The hospital was strategically located and is bounded to the north by Jota district, south by Wa municipal, and to the east by Dafiama Guse district. To the west is Charpon, and a staff strength of 264 permanent staff and 53 locally employed staff. In 2013, the hospital was adjudged the best district hospital in the year by the Ministry of Health, and was, as a result, it was referred to as the famous Toliku Corporate. The gates of the hospital have been consolidated over the years, though faced challenges. Right, Honorable Speaker, after the days of glory of the hospital were bedeviled, right, Honorable Speaker, management tried all possible means by introducing various strategies to mitigate these challenges. Despite these, some few successes were recorded. There was still the need to seek for external.
We had a director before. I don't know why God loves us so much. We always bring a lady as a visit director of health. We had one before from Joe. She was excellent. And they did a swap, and they brought us this one with us here. And exactly an angel to us. She came and continued the good work, never gave me space to sleep. And that's what she's still doing. She doesn't allow me to sleep at all. And with that, knowing my beginning, where I was born, and how I struggled to grow up, which are all lessons. You always call this suffering. No, they are lessons. They are pearls of wisdom we learn. I really have a very sharp conscience, and I find it difficult to sleep knowing how my people are suffering. And so I do everything, and I'm happy that you always mention our development partners. Because anytime we cry and we reach out to them, they come to our aid, and they have done marvelously well. some of the beds, the mattresses you see here, had to reach out to as far as Germany to bring them down to Ghana. And that time they came in their numbers and they were distributed around the whole region. But definitely, charity begins at home. We got the lion's share. It's just that some of the equipment could be used at a regional hospital. They couldn't be used as a district hospital. So they had to be used at one. And so a lot of this has happened because of the benevolence of others in their countries who decide to sacrifice. Not because they have, but because of love for humanity. Through their taxes, through their charity work, they support us. So we should be grateful and thankful to them. It's not just me, the former member of parliament, or second deputy speaker, or speaker of parliament. No. The left honorable seated here, you know, you can't have right without left. So once I'm called right honorable, then my wife should be called left honorable. And so when I introduced left honorable concept in Ghana, people were really surprised. But that is a good initiative. You know, the men must always know that without the neck, there can be no head. And the ladies are the neck. Before you can turn your head, it's the neck that will what? Turn it. And if you don't appreciate and honor that, you are in trouble. You will never succeed. And so she's been doing a lot, particularly where she works. And she's been working with UNICEF from 1989 up to date. So in terms of leadership in the office of the UNICEF in Ghana, there are only a few of them left who can count themselves as experienced as she is. So almost every year we get support from UNICEF to equip here, particularly the children's ward. They supported a lot of the rest, including JICA and all those. They all supported a lot. And so I'm really lucky that my successor happened to be a health worker. And throughout my political life, I happened to be 1 year the Minister of Health. So for me, it's health that is first, not education. Because if you come out unhealthy, it will be difficult for you to be educated. And so the health of our incubators, the women, are very paramount. They are the people who give birth to us. And so if they are not healthy, you will not be healthy at all. And that's very, very important. And so we've been trying to catch up, because our focus is in one area of health, curative. All this we talk about is about curative, even though public health has been mentioned. One of the things that we need to preach and to try and inculcate in you is the preventive and promotional health care. Because we all know Tata Masera Barmandu. Prevention is better than cure. When we were a kid, there was one what do you call them? Drug one, peddlers, who used to go around from village to village, injecting people with very strong medicine. And he used to tell us that kana sala yelen kaka hoba biara kacho biwo tini kaki wo biara kachi trape no ka intervention in trachea. Whatever kind of school. So prevention is better than cure. So the intervention in trachea. So we have to take that one very, very serious. What we eat, what we do is very important. Look at where we are now. We are all sweating. And we are just praying that this function should finish early for us to go out. And when we even go out, we are going out into what? A very hot sun. We talk about greening Ghana. We'll be talking about planting trees. How many of you do that every year? Just one. Every year, just one tree. For it to get the good breeze, the oxygen during the daytime. For it to get this threat of climate change, which usually is referred to as existential threat, means is capable of ending our lives. How many of us think about that? It's not just buying equipment, buying disposables, pharmaceuticals to come and cure it. We can prevent it. So very soon, I want the youth to take up this matter and start some competition. Tree planting. And they should be fruit trees. And trees with very good shades. Then we do competition. If we are able to succeed in this, we'll prevent a lot of the diseases that we have. Now we're having the serious threat of CSM because of the heat. Anytime you visit the villages, you see that they are struggling to get shades, tree shades to sit under. And all the trees are perishing. Particularly the very key ones like Akiapo, Dawa, the best, Bipolar. You know, banana Bipolar. And that's the best food. Unfortunately, the young ones don't understand it. So they don't eat pala. And so when you get sick, it becomes a big